Yeah, so I have Izzy and Tim here. How are you guys?
Not bad.
Yeah, pretty well. Happy to be finished. First
Nice.
semester done.
Nice. Just finished exam?
Yep. So last of 2 exams for the end of semester. So finished our last cumulative task on Monday, and then our short answers today. So yeah, very happy.
Do you feel like
through our first year?
do you feel like you're getting closer to being a doctor or not even close?
No.
I mean, for this pathway for us, we're now halfway through. So we did 3 years of undergrad. We've done half a semester here, and it's out of 7 years. So we've got 3.5 done, and we've got 3.5 to go still. So yeah, it's a long haul, but having good fun still enjoying it.
Yeah.
Okay. So today we're just gonna talk about why you guys are here. I know you mentioned it in respective videos about why you do medicine, but we would like to hear it. So what is it for you?
I've always had a pretty passion for medicine, I suppose. I go back to the old stories of when I was a scout, and I used to love going to first aid courses, and not to sit there and get a didactic lecture for the whole day, but I was really, really curious and kept asking questions of why certain things happen and why we treat people certain ways. So I've always been pretty interested in that side of things. I combined that with a really big, I suppose, want to helping different people. And you know, I suppose when you put all those sorts of things together, the obvious answer was medicine. Well, I actually had to decide between paramedicine and medicine, and eventually ended up going medicine.
Okay. And Izzy, what was it for you?
Yeah, I think similar to Tim, just I have an inner curiosity about how things work, and I enjoy learning. And so everyone always says when you're doing medicine and how long you've been studying for and how long you have to go, like they say, oh wow, that's so long. And my reply is always, yeah, but I really enjoy learning, so it doesn't feel like a chore to me. And I think medicine's a career where you can always keep going as well. You don't just get spat out at the end and that's where you stay for the rest of your career. You can grow and you can move into different fields. You can go into research if you want to. So I think that flexibility about having a career in medicine is really, what attracted me to it as well.
Excellent. Now there's a lot of ways that we're actually learning. One of them is inside the classroom learning, and then self-directed learning, and we also go to clinic and hospital. What is that like for you so far?
I think it's a really good mix. It appeals to people with different learning styles. So if you're more a practical learner, you get that opportunity in a clinical environment. But if you're somebody who doesn't mind reading out of textbooks, you can absolutely do that in all the free study time that we've got. There's a really great deal of flexibility between, I suppose, the practical side of things and the more didactic theory side of things. And no matter where you fit on that scale, there's always an option for you. Everything from practicing in-person clinical exams here at uni with your mates, and then trying to relate clinical concepts to that, all the way to sitting down with the textbook, you know, all day, every day, and learning them that way instead. So my preference, I suppose, is a really nice mix of the two. I don't like sitting down inside textbooks all day, every day. But likewise, I also don't get all the learning that I feel I need to by, I suppose, practicing clinical exams all day, every day. There's still a bit of, I suppose, heavy theory that needs to go along with medicine. So by combining the two, I feel that's been working quite well for me so far.
Yeah, I think where the sort of placement side of things come in handy is it reinforces the learning that you're doing in the classroom and at home by yourself. So if you see something that comes up and that's what you've been learning for the past prior weeks, it sort of reinforces that and demonstrates how it presents clinically, which I think in my mind helps me remember things better when you can, you know, formulate a patient in your mind. And that's really useful when it comes to exams as well, because you can sort of relate the theory to how a patient presents with that problem and how it was fixed in placement. Like you got to see the GP and how they treated that or whatever they did. So yeah, I think they definitely go hand in hand, but I think I'm looking forward to getting more into the practical side of things. That's what excites me.
Awesome. Now at Uni Melb, we're engaging with the patient in first year, which is something new and exciting. How is that different from your perception that you had earlier?
So this is a relatively new curriculum, new structure, particularly having people doing placement right from year one. So I suppose our perception of what med school was going to be was just simply what it always was up until this point. So generally 1 to 2 years preclinical and then either 2 or 3 years of clinical. So that was my perception. I thought I'd be spending the entire first year hitting the textbooks, not really learning too much about the practical side of things. But yeah, I was pleasantly surprised when I came here and worked out that I'd be in hospitals, in GP practices and getting to practice exams on our mates right from the start.
Yeah, I think the experience of practicing with real life patients, the earlier on you can get it, is definitely beneficial. Even just learning people skills and how to just make small talk with a patient or make them feel more comfortable in the room, I think is those skills, those sort of soft skills are sometimes undervalued but very important in building rapport.
Excellent. What is one thing that you have observed while being on placement? When you talk to patients, when you talk to the doctors, what are the needs of these places that we go to?
I suppose what we see out here is a little bit unique because we're of course doing all of our placements in rural areas. So we see not only post-COVID staff shortages and most of the other challenges that metro hospitals and GP practices find, but we then combine that with all the, I suppose, barriers to accessing good quality healthcare that come with living in a rural area. So things like, I suppose, the classic rural stoicism, as we call it. So I suppose that stereotypical older farmer who doesn't really want to admit that there's anything wrong, tries to go about saying, nah, she'll be right. It's challenging, but it's also really, really interesting the way that we can engage as healthcare professionals to try and get those sorts of people, the healthcare that they deserve. Seeing that from first year, I think is really, really cool. Because I mean, we've all grown up in the rural areas, so we've seen it from a patient perspective. But seeing what you can do as a future doctor to help improve that person's access individually, I think that's really, really cool. Pretty unique that we get to see that right from the start.
Yeah, I think it's interesting as well from sort of the conception of this course that we've been in. We've heard that there's this need for rural doctors and that's the aim of the program, and you always hear about it wherever you go. And obviously I've grown up in a rural area my whole life, but haven't probably been close enough to the medical field to really notice that impact. But now on my placements, you see the impact of the doctor shortage and the stress and strain that puts on the healthcare system and on the doctors and on the nurses, and the effect it has on the patients ultimately accessing healthcare, as Tim mentioned. So I think that's been really interesting for me, that it's not just this sort of airy-fairy concept that there's a doctor shortage, but it's real and it does have an impact on people's lives and their livelihoods.
Wow, that's incredible. What do you think the solution is, considering that when we go on placement, some of the patients will tell us like, oh, please stay here. And they're like, yeah, we're gonna stay, but that haven't been the case because every year we have a lot of doctors that flood the sea and a lot of doctors within Australia, but nobody's staying in rural areas. So
it's a very weighted question, something that's been debated for ages and ages now, and carries with it a lot of importance because there's this massive barrier that people who live in rural areas face to accessing healthcare, and most of that, like Isabella already said, is because there's a shortage of healthcare professionals out here. So the question being, how do you then attract healthcare professionals to these areas? One of the solutions, I suppose, is training country people to then practice in country areas, which is why we're here. There's always lots of ideas being thrown around. I've heard a couple relating to how we go about lifestyle for rural doctors. So do we decrease the workload of lots of doctors as opposed to trying to recruit a few doctors and then get them to work heaps? So we recruit a really large amount, put them on perhaps part-time work so that they still get to enjoy the lifestyle that comes with the country. And we don't overwork them to the point where they're scared off by it. So I think addressing sort of those barriers to having a good work-life balance in the country as a doctor, I think that'd go a long way. Probably something that a lot of us are a little bit concerned about is how we get a balance in medicine with family and living in a nice area and I suppose having a life outside of medicine.
Yeah. Yeah, I think having those supports in place, especially in rural areas where there might only be one doctor on call, and that's a lot of responsibility for that person. And if they're faced with patients or scenarios that they're not necessarily equipped to handle, or if they don't have the equipment to use to handle that situation, then that can be pretty stressful. So I think there needs to be support and there needs to be the appropriate facilities. And I think as well, we can bring people from the city out to the country, but to keep them here, we need to integrate them into the community. So whether that means getting them involved in local sporting clubs or finding hobbies or groups that they can make friendships and they can make meaningful relationships and have that support if they're forced to move away from their family.
On that note, that easy say, what can we say to someone now that might be watching this video and they say like, wait, I've actually been practicing in Metro as a doctor for a really long time. I would really want to try out in the rural area and see how that is like. What do we have here that can attract them?
I think we've got a slightly different perspective on this. We've grown up in country areas, so of course we're naturally a little bit biased. And we're students, so we're not fully qualified doctors yet. But I mean, my opinion would be the country's absolutely beautiful. There's so much to do out here, so many hobbies that most people just don't even think about being a possibility, that we've sort of grown up with and always had, that you can't access in metro areas. But then from a medical perspective as well, really, really awesome, broad scope of practice. There's great training opportunities here. It's not necessarily that you're practicing unsafe medicine. That's not what the expectation is. You get trained in the areas that you're expected to perform in. So you get to, I suppose you get to do more because we've got a smaller amount of doctors. You get to take on a little bit more responsibility if you're willing to. Broaden your scope of practice, start to think outside the box a little bit and get back down to, I suppose, fundamental medicine, trying to work things out for yourself and really get to the root of problems and do everything from family liaison through to the diagnosis, through to the investigations, liaising with all the different allied healthcare professionals. Because in some of these smaller towns, you're in, and yes, you get to titrate your work and life balance until you find the right mix. But I think having the ability to do all of those different things, I think that's really, really cool, really unique part of medicine, and I think something that you don't necessarily get as much exposure to in metro areas.
Yeah, I think you just can't beat the good old country fresh air to start
That's
with.
True.
So yeah, there's just so much to do. Like if you're an outdoorsy person especially, just get outdoors, go for a hike, go for a canoe, go four-wheel driving, go camping, go down the river, go to the beach, whatever you want to do. There's so much. And I think another thing about the country is the people. Because you're usually in a smaller town, you get to build up a rapport sometimes with a patient and their extended family as well. And that interconnection is really nice. And I think I'd imagine as a GP, you'd get to see a child grow up and see their siblings grow up and have that extended care, which I think is really awesome.
There's a really cool sense of, I suppose, a community and purpose, isn't there?
Yeah.
You feel like you're really playing a role because the people that you're helping you see most days. You see them down at the supermarket, you see them at the local footy match, you see them down at the pub. So you get to see your work in action. It's pretty cool.
I think that's really amazing because purpose is what drives a lot of people. So Dr. Frank Emil wrote a book called A Man's Search for Meaning. Such a powerful book. Before we conclude, what is it that other 29 med students at the University of Shepp doesn't know about you, Tim?
That's a very good question. I'm actually a pretty open book. I touched on this earlier, I don't think most people would know, I was extremely close to wanting to become a paramedic. And I changed my mind.
What changed?
my, I suppose, scientific curiosity got the better of me. I studied a scientific undergrad, so I did biomedical science, and really enjoyed the research side of things and whatnot. And that's not to say that as a paramedic you can't get involved in that sort of stuff. But the avenue that I wanted to take my life being a balance between, I suppose, science and clinical practice, just found med was definitely going to be a better fit for me.
What is it for you, Izzy?
Jeez. I think maybe that I've just wanted to be a doctor since I was about 3 years old.
Oh, wow.
So it's been a long-lived dream for me. So yeah, I used to have this little doctor's kit when I was little and it had the patella hammer and the little stethoscope and everything in it. So I've probably still got it somewhere at home.
Nice.
Should probably bring it back out.
Yeah, it's still useful.
Yeah.
So you pretty much got programmed while you were really young.
Yeah. Mum and Dad must have had it in the back of their mind.
Nice. Now that we're heading on holidays, what are the plans?
I'm going to do a little bit of travel, going out with the family to Broken Hill for a little bit, do a little bit of country sightseeing, work, try to relax a little bit, see a few friends who I haven't been able to see for a while.
Nice.
Few guilt-free sleep-ins, just a couple of day trips, binge watching Netflix. That's about it.
Nice.
Awesome. Any last comment?
Happy days.
That's it from me.
Thanks, guys. Appreciate it. Go and enjoy your holidays. Don't think about exam or think about it. I don't care.
Yeah, no,
Right.
it's out the window now.
Done.
Long forgotten.
Who are these guys?
Get
Look
outta
at this
here.
guy.